benefits on the fly. Today, I want to talk about rethinking your benefits from buying insurance to building care. If you're in charge of your company's employee benefits, here's the uncomfortable truth. Buying a health insurance policy is not the same as building a healthcare plan. Health coverage is paperwork. Health care is what actually happens to your people. Today, I'm going to show you how employers can move from we purchased a plan to we designed a plan that gets our people healthy. Let's start with the problem. The cost of healthcare keeps rising. Deductibles also keep climbing. And your employees are still putting off the care that they need. Roughly 1/3 of covered workers are now in health plans with deductibles higher than $2,000. What does that mean for most employees? Even with insurance, they often delay treatment because of cost out of their pocket. Recent national polling shows about 37% of adults who have insurance have skipped or postponed needed care or medications in the last 12 months. So here's how you can make a real impact on this problem. Stop thinking like a purchaser and start thinking like an architect. Your job is not to pick a logo or a premium or a network discount. Your job is to build a care pathway that removes friction, guides people when they're overwhelmed, and pays for what improves outcomes. Insurance is just a component of your overall benefit strategy. Care design is the actual goal to helping your employees and reducing costs. To get started, the first step is to remove financial friction that your employees face by getting rid of the paywall at the front door of care. And this comes in the form of high deductibles. Studies associate high deductible plan designs with reduced willingness for employees to seek care. Here's a practical solution that works for this. You can fund first dollar access to those high value services like primary care, behavioral health, and chronic disease medications through plan design levers like health reimbursement arrangements or direct primary care arrangements or carve-outs for condition management. When you lower the out-of-pocket barriers for essential treatments, employees don't wait until small problems become big claims. The payoff is fewer avoidable emergency room visits and complications over the plan year. And yes, these claims will affect your premiums the next year. The second step is to help guide your team through the healthcare maze with real humans. Tech is great, but benefits confusion is often a human problem, causing anxiety, wasted time, and a lot of uncertainty. Care navigation programs that blend clinicians and pharmacists and advocates can produce measurable savings and strong employee satisfaction. And when programs include hands-on navigators, employee satisfaction commonly lands in the 80 to 90% range, which matters because engaged members actually use the plan the way it was designed. Because engaged members actually value the benefits you're providing and they use the plan the way it was designed. Third, you should be paying for outcomes, not illusions. Stop chasing network discounts and popular logos on your medical card as a proxy for value. A discount on an overpriced service is still expensive. Don't be misled into believing higher costs or brand name insurance companies mean better care for your employees. Here's a simple blueprint on how you can build your healthcare ecosystem. Number one, map your friction points. Where do people hit their cost barriers early on? Primary care? Is it mental health? Is it maintenance meds? And carve in first dollar coverage for those services and then monitor the utilization monthly. Remember, high front-end cost sharing is strongly associated with deferred necessary care. Number two, stand up a human navigation system. Contract for nurse and pharmacist-led outreach, not just a chatbot. Then measure your success in closed care gaps, resolved prior authorizations, and reduced out-of-network spillover. Number three, choose funding that fits your risk. Many small and mid-market employers blend self-funded or level-funded designs so they can actually see their claims data and tune the plan. More data means more flexibility to design true care pathways for your employees. And number 4, get reports on what matters. Move beyond premiums and logos on a spreadsheet. Track your employees' time it takes to an appointment, or their adherence to chronic meds, or their behavioral health access, and emergency room utilization that's avoidable. These are the levers that change the total cost of care. Employers don't have to accept a false choice between affordability and access for their employees. When you knock down the financial barriers and you add in real support guides and you pay for results, not just contracts, the plan becomes a care system your employees can actually use. Don't just buy coverage, build care. Your employees and your profit and loss will feel the difference.